Hello, everyone. Thank you so much for joining me today. My name is Carolyn Bazan, and I work at the Mental Health Association in New Jersey, and I currently serve as the director of the Career Connection Employment Resource Institute. And today we will be looking at an overview of trauma and post-traumatic stress. So during my time as a clinician, I have been able to experience and work with individuals with post-traumatic stress disorder who have endured different forms of trauma and have had different forms of reactions to trauma. And so today, my hope is that you gain an understanding of what symptoms of trauma can look like, as well as different types of events that may trigger trauma responses, and how we can help someone who may be experiencing a trauma. First and foremost, let's define what trauma is. Trauma is the response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope, causes feelings of helplessness, diminishes their sense of self, and their ability to feel the full range of emotions and experiences. Trauma is this wound that can significantly affect so many different areas of life. It can affect your job, it can affect your relationships, it can affect your parenting, it can affect how you relate to others, it can affect your sense of safety in this world. And it may also affect your ability to ask for help, for your ability to share what happened to you. And that can be because of shame, guilt, which we'll talk a little bit more about. And it can also really affect someone's self-esteem, their self-worth for what they've been through, as well as being able to feel like the world is a good and safe place to live. So that can really cause distraught and color this world into something that's not safe anymore, like the world is a dangerous place. So now let's look at the types of traumatic events. It can be a one-time event, meaning that person was in a car accident once, so it's a singular event that happened to that person. It can be ongoing stress. For example, a person living in poverty or homelessness or ongoing abuse in the household. So this is going on throughout their lifetime. And commonly overlooked. And I love talking about this one because I feel like sometimes even as loved ones, caregivers, peers, coworkers, we tend to not ask about these types of events. For example, divorce. Someone going through a divorce can endure significant traumatic stress. And we may think, okay, that's the right decision for them. It's not working out in their partnership. But how are they feeling after going through that? What about surgery? Surgery is commonly overlooked as well. A person may need a surgery and it makes sense, right? They need to heal from this diagnosis or this illness, so they have to go through the surgery. But the aftermath of that surgery can be very traumatic, or even just experiencing that surgery. So as loved ones, I think we need to be aware of the emotional responses to going through these things. Here are some examples of traumatic experiences. So we mentioned car accident. There's also natural disasters, Hurricane Sandy, Hurricane Irene, sexual assault, rape, abuse, emotional or physical. The pandemic was something that as a collective community, we endured and saw many different types of traumatic responses. What are some other examples you can think of? Take a minute to think about some other traumatic experiences that you may have heard of, maybe someone you know went through one, or even for yourself. In my experience working in supported employment, supported education, and seeing what people experience in terms of not just the traumatic experiences, but the responses, it looked like depression, it looked like an anxiety disorder, it looked like bipolar disorder, it looked like everything else except post-traumatic stress disorder, meaning that sometimes the clinicians they were working with were not tying all these symptoms to a trauma. And so it was this hidden story or hidden experience that clients were going through, but we had no idea it was tied to something they went through in the past. And so once you can make that linkage, that person is now reacting because of something they went through, it can be easier to help them heal or at least navigate through these responses. And so here are some symptoms of trauma that are common: sadness, extreme sadness, fear, fear of the world, fear of other people. Just think about if you were sexually abused. Maybe you now fear the opposite sex. Now you fear going out in the world and just doing your everyday activities. Guilt. Maybe there's this feeling of, well, I should have done something to prevent that happening, or I shouldn't have been at that place at that time. It's my fault. I brought that trauma onto me. So I experience a lot of individuals blaming themselves for their trauma. Shame. I'm embarrassed to share what happened to me. And when I work with clients with PTSD, they would be sharing with me that I'm the first person they ever told about the trauma because they never wanted to share about it, or they were too embarrassed. They didn't know what their family would say, or if they would even be believed by their family. Nightmares, very vivid dreams of what happened. Flashbacks. A person can be sitting on the couch, watching TV, and all of a sudden they feel like they're back in time reliving that traumatic experience. It feels so real. I've had clients say that they smell distinct smells from the trauma, tastes, something about like almost like a movie replaying. Headaches. Just think about thinking about the trauma all day. You start to get chronic headaches, gastro issues, stomach problems, ulcers. All the stress starts to take a toll on your body. Anger. And this is, I think of it as appropriate anger, where a person is really upset and mad that they went through this experience. Difficulty trusting others or the world. So after you've experienced a trauma, it can be very hard to rebuild that trust with humanity or feel like the world is a safe space to be in. So I want to ask you, what percentage of adults in the US have experienced some type of traumatic event at least once in their lives? What do you think? Is it 25%, 50%, 60%, or 70%? Give you a second to think about it. Okay, if you think 70%, you are correct. 70% of adults in the US have experienced at least one traumatic event in their lives. I want to share with you some numbers to put this into perspective. So we know about 70% of adults in the US have experienced some type of trauma. However, what about the people walking through the doors at the Mental Health Association in New Jersey? We see that over 90% of individuals using behavioral health services have experienced a trauma. So what does that say? That tells me that if someone is coming to me for mental health services or behavioral health services, they most likely have experienced a traumatic event. And we see that up to 20% of these people go on to develop post-traumatic stress disorder, one of the most debilitating diagnoses in mental health that one can experience. And as of today, that equates to approximately 44.7 million people who were or are struggling with PTSD. I also want to acknowledge adverse childhood experiences, or ACEs. These are events that happen before the age of 18, such as intimate partner violence. A child may witness their parents fighting, physically fighting, or they may endure bullying. A child may witness their parents go through a divorce. They may witness one or both parents using substances. They may experience sexual abuse, and also going through the loss of a loved one or traumatic grief, such as losing a grandparent at a young age. Now let's take a few moments to watch a clip by Nadine Burke Harris. I think you will enjoy this video. She talks about what trauma can do to the developing body and brain. So what do our children endure, and how does that affect a person in their adulthood? I hope you enjoy this video.
Science for prevention and treatment. That's what we do. So in San Francisco, we created the Center for Youth Wellness to prevent, screen, and heal the impacts of ACEs and toxic stress. We started simply with routine screening of every one of our kids at their regular physical, because I know that if my patient has an ACE score of 4, she's 2.5 times as likely to develop hepatitis or COPD. She's 4.5 times as likely to become depressed, and she's 12 times as likely to attempt to take her own life as my patient with 0 ACEs. I know that when she's in my exam room. For our patients who do screen positive, we have a multidisciplinary treatment team that works to reduce the dose of adversity and treat symptoms using best practices, including home visits, care coordination, mental health care, nutrition, holistic interventions, and yes, medication when necessary. But we also educate parents about the impact of ACEs and toxic stress the same way you would for covering electrical outlets or lead poisoning. And we tailor the care of our asthmatics and our diabetics in a way that recognizes that they may need more aggressive treatment given the changes to their hormonal and immune systems. So the other thing that happens when you understand this science is that you'll want to shout it from the rooftops, because this isn't just an issue for kids in Bayview. I figured the minute that everybody else heard about this, it would be routine screening, multidisciplinary treatment teams, and it would be a race to the most effective clinical treatment protocols. Yeah, that did not happen. And that was a huge learning for me. What I had thought of as simply best clinical practice, I now understand to be a movement. In the words of Dr. Robert Block, the former president of the American Academy of Pediatrics, adverse childhood experiences are the single greatest unaddressed public health threat facing our nation today. And for a lot of people, that's a terrifying prospect. The scope and scale of the problem seems so large that it feels overwhelming to think about how we might approach it. But for me, that's actually where the hope lies. Because when we have the right framework, when we recognize this to be a public health crisis, then we can begin to use the right toolkit to come up with solutions. From tobacco to lead poisoning to HIV/AIDS, the United States actually has quite a strong track record with addressing public health problems. But replicating those successes with ACEs and toxic stress is going to take determination and commitment. And when I look at what our nation's response has been so far, I wonder, why haven't we taken this more seriously? You know, at first, I thought that we marginalized the issue because it doesn't apply to us, right? That's an issue for those kids in those neighborhoods, which is weird because the data doesn't bear that out. The original ACEs study was done in a population that was 70% Caucasian, 70% college educated. But then, the more I talk to folks, I'm beginning to think that maybe I had it completely backwards. If I were to ask how many people in this room grew up with a family member who suffered from mental illness, I bet a few hands would go up. And then if I were to ask how many folks had a parent who maybe drank too much, or who really believed that if you spare the rod, you spoil the child, I bet a few more hands would go up. Even in this room, this is an issue that touches many of us. And I'm beginning to believe that we marginalize the issue because it does apply to us. Maybe it's easier to see in other zip codes because we don't want to look at it. We'd rather be sick. Fortunately, scientific advances and, frankly, economic realities make that option less viable every day. The science is clear. Early adversity dramatically affects health across the lifetime. Today, we are beginning to understand how to interrupt the progression from early adversity to disease and early death. And 30 years from now, the child who has a high ACE score and whose behavioral symptoms go unrecognized, whose asthma management is not connected, and who goes on to develop high blood pressure and early heart disease or cancer will be just as anomalous as a 6-month mortality from HIV/AIDS. People will look at that situation and say, what the heck happened there? This is treatable. This is beatable. The single most important thing that we need today is the courage to look this problem in the face and say, this is real, and this is all of us. I believe that we are the movement. Thank you.
One tool we use in the mental health field is the ACEs survey. So that gives us a number of how many adverse childhood experiences a person went through before the age of 18. Here is a sample question. Did a parent or other adult in the household often or very often swear at you, insult you, put you down, or humiliate you, or act in a way that made you afraid that you might be physically hurt? So if you answer yes to this question, you obtain 1 ACE score. And there are 10 questions similar to this that ask about household dysfunction, abuse, and we tally those up and you will get an ACE score. And so you will find a reference to this ACEs survey in the reference section. So if you are curious to know your ACE score, you can fill out this survey. So why do we ask about the ACE score or ACEs survey? Well, with an ACE score of 4 or more, the likelihood of experiencing chronic pulmonary lung disease increases by 390%, hepatitis by 240, depression by 460, suicide by 1220%, eating disorders by 5,000, and IV drug use by 5,000. So knowing someone's ACE score can tell us a lot and link what they went through in childhood to some of the factors that are affecting them today. Here is a whole life perspective of how adverse childhood experiences can lead to early death. So we see that a child may go through physical abuse in the household before the age of 18. That can then affect them socially, emotionally, and cognitively, where that child may no longer be able to think rationally or clearly. They may struggle with feelings of happiness. They may not be able to connect with others socially or trust other people. And then what happens is that they may now adopt health risk behaviors such as utilizing substances, using alcohol or marijuana to cope with the trauma, which is now then leading to disease, disability, and social problems. They now may face incarceration because of drinking and driving. And all these factors can lead to early death. And that's why it's important to know experiences in childhood as well as adulthood. It's been nearly 5 years since COVID-19 happened, or the pandemic, when we were in the weeds of that horrific, scary time. And I know it has affected the world so much since then in terms of even how we behave or our reactions to new diseases or new threats, but it still feels like an ongoing reaction that people face. And we saw that this was a direct threat to our lives and our loved ones. So that was this communal feeling of fear that we went through together. We also saw our loved ones go through COVID-19. Maybe we weren't affected by it personally, as in we weren't infected by it, but maybe we lost a loved one to it, or we saw our loved ones struggling with the aftermath of COVID-19. Perhaps they lost their job or they were no longer able to pay their bills. And so we took that vicarious trauma in that we were now feeling those reactions because of what we were hearing others go through. Frontline providers were significantly affected by COVID-19, where they were faced to pick who gets a ventilator or pick who they can treat because there were so many people affected, and it almost became where people were choosing life and death in very scary times. And we all went through this sense of grief where we could no longer participate in the world anymore and socialize and Maybe we lost a lot of the things we used for self-care, such as going out to eat or going to the mall, whatever it may be, but we lost a lot during that time. And I still feel like there's still that aftermath going on, but this is a significant trauma that a lot of us endured. And I just wanted to touch on this today. I wanted to bring up this term moral injury because I feel as though it's not talked about enough. But when, for example, a frontline provider, a doctor had to pick who gets a ventilator, they're now choosing who lives versus who dies because of lack of resources. It is a strain to their morality. They are going against what they value, what they believe, what they signed up for, which is to save everyone. Veterans, we see this a lot as well, where they may have accidentally killed someone in warfare, and now they have to deal with that moral strain. And so moral injury is the damage done to one's conscience or moral compass when that person perpetrates, witnesses, or fails to prevent acts that transgress one's own moral beliefs, values, or ethical codes of conduct. And so this can become a spiritual strain. I've seen people walk away from their religion. I've seen people no longer believe in a higher power because they had to endure this traumatic experience. And they're questioning, like, what is my purpose? Why was I put on this earth to go against my values and morals? And so they significantly lose a part of their identity that used to bring so much hope and faith in their lives. And that is known as moral injury. So one thing to be aware of if you do go through a traumatic experience, or you know that a loved one or a coworker has experienced a trauma, that if they are still having reactions to that traumatic experience after 4 weeks or after a month, it could be post-traumatic stress disorder. So that could be a time where a person may want to talk to a mental health provider. Of course, any time is the right time to talk to someone. But if you see that you're still having reactions a month later after the trauma, it could be PTSD. There is no right or wrong way to react from trauma. People can react in so many different ways. One person may dive deeper into their work to not think about the traumatic experience, while another person may not leave their house for many days after a traumatic experience. So there is no right or wrong way to react. The point is to notice that there is a reaction from this trauma, and that's where we can help. We don't want to ignore any feelings or symptoms that a person is experiencing. We also want to help someone keep their mind occupied, and that could be through walking, through physical exercise, through journaling, through meditating, talking to a counselor. But it helps to distract the mind from the traumatic experience and heal in that way. Also, reestablishing a routine. I often find that people I work with stepped away from the routine that they used to have and love, and now it's getting back on track to that routine so that they can start to heal from that traumatic experience and those memories. So reestablishing a routine can be very helpful when it comes to healing. It's also helpful to acknowledge that it's normal to have a reaction to an abnormal event. Life is challenging, and it is okay to feel unhappy, to feel angry when our life is disrupted or when we are in severe distress. But we can also acknowledge that we can bounce back when we go through those life challenges. We can learn some new coping skills through those challenges, and then the next time a traumatic experience happens to us, we will be able to bounce back quicker than the last time. And this goal of resiliency is to minimize the impact of traumatic events, to avoid depression, to avoid anxiety, to avoid PTSD. So I try to tell my clients we're going to add more tools to our toolbox so that the next time we go through a challenging time, we will have more things we can utilize to get through this difficult time. So resiliency is not a trait that we inherit. We can learn how to be resilient. It's a combination of behaviors, thoughts, and actions. And it's aimed at coping specifically for you, whether that's journaling, going to the gym, talking to a loved one, going to see a therapist. We can develop resiliency. Here are some tips to cope with post-traumatic stress that you might find useful. First and foremost, acknowledge that you have been through a trauma or multiple traumatic events. Acknowledging that how you feel is okay. It's okay to feel the way you feel. Connecting with others, hearing others who have been through similar traumatic events as you may be helpful to hear that you're not alone. Exercise, jogging, aerobics, bicycling, or walking. I remember hearing another therapist say that you have to do something with the anxiety. You can't just let it kind of sit and simmer in your body. You have to release it somehow. And exercise is that free medicine that we all have, whether that's walking around the block or going to a class. Relaxing, trying yoga, breathing, meditation, releasing it that way by stretching. Taking up the arts, listening to music, other diversions to get your mind off the trauma. Maybe it's looking at your nutrition and seeing how you're eating, as well as your sleep hygiene. Are you sleeping enough? Avoiding using stimulants, overusing stimulants like coffee or maybe too much candy, such as sugar or nicotine. And committing yourself to something personally meaningful every day, waking up with purpose, waking up with a goal, even if it's a small goal to get yourself out of bed. Write about your experience for yourself or to share with others, turning your lemons into lemonade, sharing your story. Maybe you will encourage others to find hope in the traumatic experience they went through by hearing your story. There are some traditional treatments that have been known to be helpful. They are studied, tried, and true. For example, cognitive behavioral therapy is very efficient and effective in helping individuals who have experienced trauma. The therapist will help challenge negative thoughts that a person adopts after going through a traumatic experience. For example, a person may now feel like a failure after going through a trauma, and the therapist will help that person challenge that negative thought. There's also eye movement desensitization and reprocessing, known as EMDR. So this helps with singular traumatic events for a person to reprocess those traumatic experiences. And then there's talk therapy. So this is traditional talking to a therapist. Exposure therapy. For example, a person who may be afraid to drive on a highway may move through the process with a therapist to slowly expose themselves to driving again, where they feel comfortable and safe. And a therapist will help navigate that journey so that they can drive again on highways. Group therapy, talking to other individuals who have gone through similar experiences may be helpful. And I find these types of therapies very effective. So if you are looking for different types of treatments, these are a great starting point. Another helpful technique is breathing exercises. This is something that I see clients find very useful in terms of increasing awareness of their body, their responses, and their reactions to this trauma. By doing a breathing exercise, it helps the body and the mind slow down, and it can even decrease anxiety. So let's practice together. You're going to take a normal breath in through your nose with your mouth closed. Let's do a couple. In through your nose with your mouth closed. Now that you're comfortable with breathing through your nose, you're going to open your mouth and exhale slowly with your mouth open. And you can say words such as calm or relax while you breathe out. So breathe in through your nose and breathe out. Calm. Breathe in through your nose and breathe out through your mouth. I personally like to pretend I'm blowing out a birthday candle. So I breathe in through my nose and breathe out like I'm blowing out a candle. Breathe in and breathe out. Breathe in and breathe out. And this is helpful to do several times a day when you feel the stress overcome your body. Take a moment, breathe, and let your body just release that stress in the moment. And this can take some practice. You may not find relief right away, but as you continue to use this technique, you will find relief come. You may also find utilizing a picture helpful. So for example, this heart will move, and you can follow this heart breathing in. And as the heart gets smaller, you'll breathe out. Breathe in and breathe out. As you do this, start to maybe roll your shoulders, roll your head around. Release that tension. A lot of it sits in our shoulders and our neck. Feel free to release those muscles as you breathe in and breathe out. Do a few more. Breathe in and breathe out. Breathe in and breathe out. I want to thank my friend Giovanna Giocovi for helping us make this picture to assist with our breathing. I hope you found this helpful and you're feeling a little bit more relaxed. I want to end off with going back to the basics, going back to why we got into this field. What was it about this profession that motivated you to learn more about it and make this a career? What do you value most about your work? What are or what do you expect to be the most stressful aspects of your job, and what are the most rewarding aspects of your job? Also, how do you know when you are stressed, or how do other people know when you're stressed? Is there a certain behavior that you do? Do you start to change how you talk? And how can you let your loved ones know when you're stressed, or your coworkers, so that they can help you? Also, what can you do for yourself in each of the following areas? How can you manage your workload? How can you make time for your friends and family as well as your career by balancing your lifestyle? Are there some stress reduction techniques that you can adopt? There may be some things we haven't tried yet, or maybe that we're not prioritizing anymore because we are so stressed and burnt out. But I encourage you to take a look at those things. Maybe those are the things that you need to do or that we could do to feel better. I hope you found this presentation helpful. The Mental Health Association offers free emotional support from trained staff, and here is our number. We are open 7 days a week from 8 a.m. to 8 p.m., and we offer services in different languages. If you are feeling stressed or you know a loved one that's feeling stressed and needs some emotional support, please share this number. And last but not least, here are the references that were used throughout the presentation today. Thank you so much for joining me today and learning about trauma. I hope you have a wonderful rest of your day.